My experience in baseball at the developmental levels, including high school, college, um, minor league baseball, and the Olympic level, I've seen a variety of injuries. Unfortunately, the injury trends continue to grow. We're seeing adult injuries occurring in younger players. Most of these injuries appear to be attributed to volume, high stress throws, the volume and intensity of throwing, year-round throwing, year-round participation in multiple leagues and teams, and an overall lack of documentation and education when it comes to working with our young athletes and young players and developing them properly. Most notably, we see, unfortunately, it's kind of sad, but we see a high percentage, a large number of UCL injuries, and we're seeing post-operative Tommy John, ulnar collateral ligament reconstructions and internal brace procedures. We're also seeing a fair number of rotator cuff tendinopathies and tendinitises, and in some extreme cases, even rotator cuff repairs, and a significant number of labral pathology injuries in our offices. And we've been really successful in getting people back on the field, but my overall concern is, why are they ending up in our office in the first place? And again, I think PitchSafe is a great tool for travel ball coaches and youth coaches and high school coaches in particular to start to develop some means of communication with their athletes and with the parents of these athletes, so that they can approach the game a little more intelligently. They can document some of the critical things that we feel help us gain more information about how our athletes are performing, and how they are walking a fine line between optimal performance and potential injury. And there really is, not a lot of room for a young baseball player to have elbow pain and elbow issues, and issues related to volume and intensity. I think well-timed off-season training, participation in other types of athletics events and sports is helpful. But managing our young baseball players like they're professionals is really the optimal situation. And having facilities in your local area where you can go to an expert and work with them on proximal stability and biomechanics of throwing, and understanding the stresses that are placed on the arm and the throwing arm in particular during preseason and high intensity in season and off season, and making sure that parents, coaches, and athletes are all on the same page in terms of understanding when they should throw,